Right now, there are 5 people with tuberculosis in North Carolina. Numbers from the state show cases have been increasing in recent years, with 250 in 2024, which is up from 195 in 2014. Chelsea Donovan joins us live from the Department of Health and Human Services in Raleigh. And Chelsea, what do doctors say is causing this increase?
Yeah, so right now, Gerald, experts believe that this is all a byproduct of COVID when people were missing their preventative screenings. And that number that you heard from the Department of Social Services, that number 5 here so far this year, not cause for concern because 3/4 of the cases originate from outside of the U.S. They're brought in and they're spread very quickly in small spaces indoors with a lot of people. Right now, the Kansas City area is the epicenter of an unusual tuberculosis outbreak.
Tuberculosis is an infectious disease caused by a slow-growing bacteria.
It's spread through air particles and impacts the lungs with a cough and a fever.
Anything that gets large numbers of people into the same room tends to be a hot spot for these kind of outbreaks.
While it's treatable, it's spiking in our state. Not, however, to the levels in Kansas City.
We absolutely have had a handful of cases reported in our area.
Duke University Hospital said in the last week they've had less than 10 cases. Wake Med also told us today they have 1 confirmed case so far this year.
The numbers that we'd seen recently are a bit high for January alone.
There are 5 active cases right now, according to NCDHHS, 250 confirmed last year. Wake and Mecklenburg counties led the way in the highest number of cases in our state in 2023.
We're on pace for 2 consecutive years of increases in our TB after 30 years of preceding decline.
While our rates are rising, it's not time to panic.
Would you recommend folks in North Carolina get a TB vaccine?
No, I think, again, because our rates overall are pretty low.
Dr. Nicholas Turner with Duke Health believes the pandemic played a role in the spike.
We do think the COVID period affected our TB rates because, in general, there was a reduction in people's ability to access preventative health services.
All right, so good news, as you heard from Dr. Turner, no need to run out and get a vaccine. As he says, one thing that's kind of interesting here is they're only about 50% effective. We're live in Raleigh. Chelsea Donovan, WRAL News.